Hello and welcome to my channel. Today I'm going to talk about blood tests for mental illness. This is a very interesting and important topic because mental health is a vital part of our well-being, and sometimes it can be hard to diagnose and treat mental health conditions. What are blood tests for mental illness? Well, as you may know, there are many different types of mental illnesses, such as depression, anxiety, bipolar disorder, schizophrenia, and so on. These conditions affect how we think, feel, and behave, and they can cause a lot of distress and impairment in our lives. However, diagnosing mental illness is not always easy. There is no single test that can tell if someone has a mental illness or not. Usually, mental health professionals use a combination of methods, such as asking about your symptoms, your medical history, your family history, and your life situation. They may also do some physical and mental health exams to rule out other possible causes of your symptoms. But what if there was a simpler and more objective way to diagnose mental illness? What if we could use a blood test to detect signs of mental illness in our body? Well, this is what some researchers are trying to do. They are looking for substances in the blood that are associated with specific mental illnesses. These substances are called biomarkers, and they can indicate abnormalities in the brain or the body that are related to mental illness. For example, some studies have found that people with depression have lower levels of a protein called brain-derived neurotrophic factor, BDNF, in their blood. BDNF is important for memory and learning, and it helps the brain grow and adapt. Low levels of BDNF may mean that the brain is not functioning well or that it is damaged by stress or inflammation. Another example is an enzyme called ethanolamine phosphate. This enzyme is involved in the production of phosphatidylethanolamine, PE, which is a type of fat that makes up the cell membranes in the brain. PE helps the brain cells communicate with each other and regulate their activity. Low levels of ethanolamine phosphate may mean that there is not enough PE in the brain, which could affect its function and mood. These are just two examples of biomarkers that researchers are studying. There may be many more biomarkers that could help diagnose mental illness in the future. However, blood tests for mental illness are not yet widely available or reliable. They are still in the experimental stage, and they need more research and validation before they can be used in clinical practice. What are the benefits of blood tests for mental illness? Well, if blood tests for mental illness become more accurate and accessible, they could have several advantages. For example, they could make the diagnosis process faster and easier. They could reduce the stigma and discrimination associated with mental illness. They could help personalize the treatment and monitor the response. They could improve the prevention and early intervention of mental illness. However, blood tests for mental illness also have some limitations and challenges. For example, they may not capture the complexity and diversity of mental illness. They may not account for the environmental and social factors that influence mental health. They may raise ethical and legal issues regarding privacy, consent, and discrimination. Therefore, blood tests for mental illness should not be seen as a substitute for other methods of diagnosis and treatment. They should be seen as a complementary tool that can enhance our understanding and care of mental health. That's all for today's video. I hope you learned something new and interesting about blood tests for mental illness. If you liked this video, please give it a thumbs up and subscribe to my channel for more videos on psychology, inspiration, and well-being. Thank you for watching, and I'll see you next time.